Hello and welcome to the Downsized. This is the channel where we talk about all things GLP-1 related. My name is Laraine Durham and I've lost over 50 pounds using compounded tirzepatide. This post is sponsored by Mochi Health. If you'd like to start your Mochi Health journey and save $40 off, you can use my code. It's QIYG, the letter O8. You just go to joinmochi.com and they'll get you all set up. The link and the code are in the description. I'm here at the Mochi offices in San Francisco, California with the founder and CEO of Mochi Health, Dr. Myra. Welcome, Dr. Myra.
Thanks for having me.
Remember, I'm not a doctor. Dr. Myra's a doctor, but she's not your doctor. So before you start any healthcare journey, please check with your doctor or healthcare professional. Before we get started, I have a lot of questions, but I'd like you to tell us a little bit about yourself and your journey.
Yeah. My background as a physician, I started Mochi about 3 years ago now with the goal of providing access to affordable, high-quality care for obesity. So,
nice. And have you always been interested in obesity medicine? Do you have a specialty that you were in?
I have not been always interested in obesity medicine. I think it was really probably 3 years ago when the specialty was really evolving and the emphasis was moving away from bariatric surgery and towards medical management of obesity.
Yes, for sure. Yeah, we see a lot of bariatric patients that have now come to the GLP-1s and have had much better success. So that's exciting.
Yeah, this layer was always missing between like primary care practice and surgical practice. And I think obesity medicine is kind of filling in that gap now.
Yeah, absolutely. And why did you decide to start Mochi?
I had done a ton of research into the obesity medicine space, and then I wrote this thesis project basically around what the dynamic was and how the landscape was changing. So where do primary care providers send patients, and when is surgical management not the best option, and where do they end up going? And oftentimes these patients ended up going to endocrinology, or they would end up being medically managed by surgical subspecialties, and centers that were just not really a good fit for this. And so I think that was when exploring all the space and even exploring a lot of the older generic medications for obesity, I decided to build Mochi.
Yeah. Well, for years, my doctor always told me, you just need to diet and exercise, right?
Yeah.
So there's definitely a lot of opportunity, especially for people to go online, talk to a telehealth doctor through your platform.
Yeah.
It's been great for me. I've used Mochi for over a year now, and I used compounded tirzepatide. I've had great success with it. So I'm a Mochi fan. Yeah. Tell our viewers what products that you offer at Mochi.
Yeah, so every patient that comes on is paired with the physician, is paired with a registered dietitian. And then if your insurance is in network, you can also get therapy through our platform. And then we do really, end-to-end care. So we do labs, we do sleep apnea testing, we do genetics testing for patients who it's appropriate for. And then we can do prescriptions and prior authorizations for any number of obesity medications, including all of the other older generics.
So branded and compounded.
Yeah, so usually our first step is find out, have you been on a GLP-1 before? Do you know what your insurance coverage looks like? Do you want us to try prior authorization for you? And if that's a path that we want to go down, then we can do prior authorizations and send to local pharmacies.
Yeah.
We can also do any of the other generic medications of bupropion, naltrexone, et cetera, that are older medications for obesity. And then we can do compounded medications for people who it's appropriate for.
My guess would be that your compounded medications are probably your biggest portion.
Yeah, it's a mix. I think a lot of people who come on who are new to GLP-1s, they don't know what compound is.
Right.
And so I think there is an education step that needs to take place where we will run their prior authorizations and they need to talk with the providers to understand, like, here's what your chances are of getting approved. Here's, based on your intake criteria, like what our guess is, and here's what we think is the best treatment option.
Yeah. For sure. How many doctors do you have on your platform?
About 500.
500?
Yeah.
Oh, wow. That's a lot. Yeah. It's a lot more than I was expecting.
It's a lot of providers, yeah.
So the providers, I would guess, have to be licensed for each particular state, and that's why there's so many?
Yeah, so each provider, a number of providers actually have multiple state licenses, but they have to be licensed in the state where the patient is. So,
okay.
Yeah.
And I guess none of them work out of the San Francisco office, probably.
No.
They're like work from home or, okay. Yeah. So that makes it convenient for them.
For a lot of the physicians, I think they are transitioning from hospital-based environments
Oh.
or from in-person clinics, and they're used to having some component be at home versus in clinic all the time.
Okay.
And it's a nice balance to do like a mix of like part-time telemedicine online and also have like an in-person.
Yeah, I would think that would be great. The Mochi doctor that I've talked to has always been very compassionate, understanding. He never told me I just needed to diet and exercise.
Yeah.
Like he really understood, I think, the problems with traditional obesity care. So I really appreciated that.
Yeah.
Who is your target audience, would you say?
For patients,
Yeah.
anyone who does not have access to good obesity care,
Right.
which is honestly the whole country.
Right.
So.
I think I read that 74% of Americans have overweight or obesity, and yet only 6 or 7% of America are currently taking GLP-1 medications.
Yeah.
So there's definitely a huge market, and it could be any age group, any gender, all people, really.
Yeah, we do 13 and up. So I mean,
Okay.
like I think anybody who would like access to obesity medicine as a medical subspecialty, even just to talk to providers, that's a good option for us.
Yeah.
So, yeah.
That's great to know. What do you think makes Mochi different? Why should people pick the Mochi Health platform?
Yeah. A number of things. I think it's mostly about finding someone that you trust when you're getting on this medication. For most of our patients, they're not used to taking injectable medication.
No,
they are new to the space of obesity medicine.
Yes.
Some of them are, actually, I would say most are unsure of what medication they want or if they are ready to take medication. And a lot have kind of preconceived ideas of how long they want to be on medication and what they're expecting out of this.
Right.
And so a lot of it is finding a provider that you want to work with and that you trust and that you want to stay with long term throughout this. So,
yeah, I had never taken a shot. That was probably the biggest hurdle for me. And when I first came to the space, I didn't know the difference between compounded semaglutide, compounded tirzepatide. So the doctor was very helpful in explaining those to me and giving me the pros and cons of each.
Yeah,
so
it's hard. Consumers, it's hard to understand what the difference between these medications are. And so a lot of platforms that have no visit requirements, no registered dietitians, don't do prior authorizations, are really gearing you towards one product offering. And I think it's just terrible for consumers. Like it's a lot of our providers will like look at the rest of your medical history. They will go through your intake forms and understand like what medication might be a good fit for you. Right.
I think that's so important for the doctor to really understand, your personal situation, because everyone is different.
Yeah.
So it makes a difference. And how many employees do you have?
Overall, I think it's 1,000.
Oh, wow.
Yeah.
So you have some that work from home, I guess.
Yeah.
And is your customer service in your office, or are they in work from home kind of situation?
So ops has ops leadership and then ops associates that basically help with optimizing the workflows that are here. But otherwise, most of care coordination is at home because I think they're on patient phone lines.
So when I call the 24/7 hotline, I'm not calling San Francisco necessarily. But I've always been able to get through whenever I called. So that was very important to me coming to this platform, being able to get in touch with somebody immediately. If I had a message, I can send a message through the portal, and I always get an answer back within 24 hours. So I'm a big fan of Mochi customer service for sure. Let me ask you about the pharmacies, the compounding pharmacies that you use. I know your, main one is Aequita.
Yeah.
Okay, say that again for everybody out there. Aequita.
It's Latin, like it's totally fine.
Okay. And how did you start working with Aequita Pharmacy?
Yeah, it was actually a multi-year operation to try to work with one pharmacy that was going to be able to do a lot of our volume.
Yeah.
And also build a stronger relationship with them so that we had some ability to control the packaging, the operations, get visibility into what they're doing, have our own staff in an office in Seattle that is next to the pharmacy, and be able to see like end to end what the process is.
Yeah.
For a lot of the other third-party pharmacies that we were working with before that, it was, like you couldn't visit, you couldn't see anything that they're doing.
Right.
It just made it difficult to trust what was happening. So.
Well, and I really love the packaging that I get from Aequita Pharmacy. It's the blue box, and it comes in the blue Mochi thermos with the rods and the vials in there, and they stay nice and cold. I've always gotten my medication still cold, so that's I really am happy about that. And the box is so discreet too. If you've watched some of my other videos, I have an unboxing video where I show the packaging. Other pharmacies like shipping these maybe spaceship
styrofoam, like huge,
these huge insulated containers. But I really like that the Mochi box can kind of land discreetly on my doorstep, and it just looks like something you get from Amazon or some other place. So I really like that.
Yeah.
So you guys are partners, I guess. You don't own that pharmacy.
No.
You're more partners with them.
Yeah. So we have our staff that are there for operations purposes, but like we don't own the pharmacy.
Will you eventually move everyone to?
I think that's the goal.
Yeah.
There's, I think, a couple of states remaining, and our goal is probably transition over the course of the next couple of months. We don't have like a clear timeline.
Yeah.
For the pharmacy is just not approved by those states' the state pharmacy boards yet.
So thinking about the compounding pharmacies, what kind of quality controls are in place there?
Yeah. Okay. FD&C Act basically lists out like what compliance needs to take place for the pharmacy. They released a new guideline set, I believe, in 2024, and then no state actually put it into effect, and they're still relying on this older version from, I think, 2009. We wanted it to be compliant to 2024, and so we basically have been running with that and saying that these are common sense rules and you should have them in place. So every batch goes through, there's a whole list of things that are just standards for how everything has to operate, but on each batch is 3 big tests: endotoxin, sterility, and potency testing.
Okay.
So out of every batch of 250, it's about 10-ish that come out and have to just go to testing.
Okay.
That there's a cutoff for how much, basically like that it meets the threshold to be below limit for endotoxin, for sterility and potency, and then potency, it just means basically is it in the concentration range that you were aiming for.
Okay.
It's a drug manufacturing facility.
Yeah.
Like it has to be adherent to CGMP.
Right.
It has to be adherent to all of these different guideline sets.
Right.
So it has to meet these standards, and then the lot gets released from the third-party facility, and then it gets sent back in. And if it clears all those tests, then it can go out to patients. So
interesting. And I know there's been questions. I've seen people ask me questions about the bud dates or the best used by dates.
Yeah.
Like how are those determined?
Yeah. Old criteria or new criteria, because there was a big controversy and it
really?
changed.
Oh,
yeah.
I didn't know that.
So old criteria, you could basically, beyond use dates was determined by, you would just hold the samples for a certain number of months. And then there was something called accelerated beyond use date testing, which is where you could try to accelerate, you could mimic conditions to show what would happen to the peptide over the course of like 6 months or a year. And you could use those tests and basically chart out the rate of decay to extrapolate out how long this is going to be good for. The new version of this is hold the sample for long enough. And just keep identical copies in a fridge for, 6 months, 12 months, however long you want to, and then rerun the same test that you would have and make sure that it's still potent and stable.
So my 1 month supply from Mochi has about a 6 week out bud date. I recently bought a 3 month supply from Mochi. It had a 6 month out bud date. Is there a difference in the way it's manufactured to get those different dates?
No, it's a dynamic allocation of they're trying to optimize fulfillment.
Okay.
So if there's a remaining lot of vials that will expire in the next 6 weeks, you can only possibly send those to patients that are only getting a 1 month supply.
Oh.
Yeah.
I would think the throughput would be so, I would think you'd be filling so many orders. But I guess you have to, I'm thinking through this as I'm trying to
It's
figure
like an
out what I'm
inventory
saying.
planning problem.
Yeah, it's like a last in, first out kind of thing.
Yeah.
Okay.
Yeah.
That makes sense. And then another question people have is, once I puncture the vial, how long do I really have to use it?
About a month.
About a month.
Yeah.
So, and the reason for that is air or the times I puncture the top, or how does that?
The reason for that is kind of difficult. That's just the guidelines that are set by the boards of pharmacy. Yeah.
Okay.
Yeah.
So
it's also in theory like those stoppers are not meant to be punctured repeatedly.
Oh.
So a couple punctures over the course of a month 4 times is fine.
Yeah.
But if you're drawing up smaller and smaller amounts, those stoppers are not really meant to be repeatedly used.
Oh, interesting. Interesting.
Yeah.
So it's a stopper. And I guess they kind of reseal after you puncture them.
Yeah, it's just
So-
if you use it like 12, 15 times, right? Like you can
You're going to
really
put a
do
big
this.
hole in
Yeah.
that, and then it gets to the air, and then it's...
Yeah, there's just a sterility concern that kind of opens.
How did you come up with the name Mochi?
Oh, I wanted it to be a food name, and I wanted it to feel approachable because I
Okay.
think a lot of healthcare companies go with the blue branding and then they have some very stuffy name, and it just doesn't seem approachable to patients.
Okay.
So
when I hear mochi, like I've heard of mochi ice cream.
Yeah.
I guess a little.
yeah,
You know.
it's like a bite-sized
Yeah.
treat. Like it should be
Yeah.
a fun, enjoyable experience.
Okay. All right. So
Yeah.
it's fun. I like that. That's cool. What's your vision for Mochi Health over the next 5 years? Like, where do you see your company evolving?
Yeah, I think, a number of things. We want to grow this partnership with this pharmacy that we're working with. I think that there's a lot of patients want to use their insurance for medication and for all the visits and care. And so we're moving more and more people towards Wellness Plus, which is basically the in-network offering. If your insurance is in-network, we want people to be using that option to basically get all the preventive services and still get everything out of Mochi to get care.
Yeah.
We want to really expand our ability to provide this broad range of services. I think right now there's only semaglutide, tirzepatide as compounds, and then a small selection of GLP-1 injectables and a relatively small selection of generics. But as 2025, 2026, 2027,
Yeah.
there's so many new obesity drugs slated to come out, either coming through trials like phase 3 right now, or
Yeah.
they're just early phase 2 and they're expected to launch over the next couple of years,
Yeah.
that I think consumer choice will get really, really difficult. And patients will want to go to a provider to basically help them make the selection. So
Help me
usually,
decide which one to use.
yeah, with any drug category, there's a first in class, best in class. And first in class is like the first one to come to market. So birth control, statins, diabetes meds, anything.
Yeah.
And then best in class kind of evolves over the following decade of more and more drugs come out, and then these protocols kind of develop to say, based on age, other comorbidities, other previous medical history, like this might be the right med versus this might be the right med, and then a whole different escalation schedule basically forms. And so,
Yeah. I guess once we have more than 2 or 3 choices.
Yeah.
Doc, help me. Like, I have this problem. I guess they can be more specific for a patient's
yeah,
individual
first you try
needs.
this one, then
Yeah.
you do this one. And that's how it is for blood pressure medication, right?
Oh,
Like
sure.
so many other medications have a huge range.
Right. There's so many
and
statins.
Yeah, based on the person who comes in, you're getting
Yeah.
a different medication.
Oh,
So,
that's interesting. It's interesting to relate it to. I relate GLP-1s to blood pressure medicines, to cholesterol medicines. Just thinking about something you take long term to manage your chronic disease, right?
Yeah.
I think the big question that we have and that a lot of people have is the future of compounding. Like, is this going to be able to go on? How do you see Mochi being able to continue to provide compounding medication?
Yeah, so FD&C Act from the FDA basically sets out guidelines for 503A and 503B compounding pharmacies. 503B are outsourcing facilities,
Right.
And have different rules. The FDA has a very convenient flow chart as to when you can compound and when you can't compound.
Right.
The guidelines for when it's in shortage are very clear. The FDA is trying to fill an unmet need. There are people who need their medication, and it's everybody make as much as you can to basically fill that need.
To fill it.
When it's not in shortage, there's still all kinds of guidelines that exist that basically outline when you can compound. So we're expecting to continue operating within those guidelines.
So once the shortages are over, thinking of Mounjaro and Zepbound,
Yeah.
I've noticed that Mochi has changed their dosing amounts.
Yeah.
So instead of 2.5, you have 2.2, 4.4, 6.6. So is that part of your strategy to differentiate, or how did that dosing strategy
that actually
come
helps
about?
with having 6 doses.
Okay.
So the goal basically becomes that you can taper a little bit slower, and for people, there's smaller jumps between doses. So that makes it a little bit easier for patients in that regard.
Yeah.
But I think broadly, like, personalized dosing is the future, and personalized dosing can make it very easy for us to help tailor different medications to different patients.
Yes.
And also, still continue providing access.
Yeah, we've seen how some people have lost 50 pounds on 2.5, and then some people have to go all the way up to 15 milligrams to really get anything going. So I agree, it is a very personalized thing. We like that you added the 16.6 dose at the top. That's just a little bit a little bump up that
Yeah.
I think was very helpful. And also you compound tirzepatide with niacinamide, which is a B vitamin. And why do you do that?
It can help with fatigue, and it can help with nausea. It can help with a lot of other side effects that people have.
If someone is allergic to that particular thing, can they get the medicine from you without that?
So we sometimes have partner pharmacies that we work with. It depends on the state.
Okay. Because I have seen people ask that question that have certain allergies. So I see you have a program called Wellness Plus, and now you're offering some therapy through Wellness Plus. Like, how do I get to that? How does that work?
Yeah. So Wellness Plus is basically the in-network offering for Mochi. Your in-network status is determined completely separate from whether or not you have coverage for medication. So when you're going through the eligibility flow, if you give your insurance information, we can basically run a check to see if you're eligible for Wellness Plus.
So that's like when I go to an in-network doctor.
Yep.
Like Mochi might be in my network of providers. And I find that out by putting in my insurance information on your portal or on your website. So, well, I need to do that because I haven't done that yet.
If you go to schedule your next visit, it automatically prompts you to just confirm your insurance information again. So if you're on the Wellness Plus program, your provider can basically place a referral to our in-network therapist, and then the therapist provides free therapy.
Is that also online telehealth? And how long are those therapy sessions?
30 minutes.
30 minutes.
Yeah.
Okay, I was going to say because the 15 minutes might be a little short for that. And that would be those therapy sessions. If I'm in your network, would be completely covered for my monthly membership fee.
Yep.
Wow.
Yeah. So we have a $0 guarantee, which basically means that if your insurance is billed, sometimes there's like a copay or a deductible amount.
Yeah.
We will guarantee it. We will basically eat the cost.
Oh wow.
Yeah.
Oh, I need to sign up for this right away. That's great. Yeah, I think mine has like a copay.
And that's I think people really don't like this surprise amount that they get after going to a visit, right?
Yeah.
And so trying to avoid all of that. Mochi eats the cost.
Interesting.
Yeah.
Interesting. I think definitely with weight loss, and I've been battling my weight for my whole life. There's a lot of things that need to be unwound in there, right?
Yeah.
A lot of things that could be talked through, a lot of eating, not disordered eating, but I've done every diet from cabbage soup diet to keto to Nutrisystem. So what has all that, like, how do I think about now my weight now that I've lost 50 pounds, and there's a lot to unpack there.
I think it's for all types of patients. There's patients that are starting out that have binge eating disorder and they want to work with the therapist.
Oh, interesting.
There's patients that have depression that's contributing to their obesity.
Even things that not necessarily anything.
It's therapy.
Oh, wow.
It's very open-ended, and the goal is basically just to provide this as another resource to patients.
That's awesome.
Yeah.
I really like that.
Yeah.
Yeah, that's awesome. And I guess you have a network of therapists, like you have a network of doctors.
Yep. Yeah.
Licensed by the state and all that kind of
So we
stuff.
have the same thing as registered dietitians. We have our group of registered dietitians, which is also completely free in the portal, and then therapists as well.
Speaking about the registered dietitians, now will they make me a plan and tell me like what to eat, or how does that work?
They can.
Yeah.
I mean, you have one that you can message in the portal, and you can make whatever plan you want. I think there's a lot of variability between what patients want. So like you mentioned, a lot of people are coming in having tried so many different weight loss programs that they don't want this prescriptive diet, and they would rather have a list of foods that are great breakfast ideas, some recipe plans, that kind of thing.
Yeah.
But if you want a full meal plan, they can work with you on that as well. So.
Do they emphasize high protein? Like, how much is protein emphasized?
Not necessarily.
Yeah.
It's really up to you and your normal diet and what you're used to. They're more focused on making incremental changes.
Gotcha.
Yeah.
Okay. That sounds great.
Yeah.
I'll have to I haven't ever talked to the registered dietitian just because, I don't know, I maybe never got around to it, or I thought, well, I've done Weight Watchers for, all my life. So I've always felt like I knew what to eat. I just was driven to overeat.
Patients who use the registered dietitian lose 40% more weight.
Oh, wow.
Yeah.
40%
it's crazy.
more weight.
40% with any one nutritionist encounter.
Wow.
Yeah. It's
Okay,
very,
so
very strong. Like
if y'all
just-
have Mochi, you need to go sign up
Yeah.
for the dietitian.
it's free. You've already paid for it.
And that's included in your monthly membership fee.
Yeah.
So doctor visits, dietitian visits, and possibly therapy too.
Yeah.
So that's really cool. You're covering so many bases.
Yeah.
That's great. I don't think a lot of other telehealth providers are doing all those things. So
Yeah, I think it's hard to, I mean, we do our own recruiting and we do our own hiring for all of these different platforms. And it's a difficult balance basically to make sure that we have enough availability for every state.
Yeah.
Our goal with any kind of clinical recruiting has always been quality. We can always get you licensed. We can't make you a good provider. And it leads to a whole skew of things basically.
I guess a lot of people wonder, will I have to take these drugs forever? What's your point of view on that?
I think it depends. Could you come off of medication? It's totally up to you. I think, like statins, like any kind of other chronic condition, once you have obesity, you should treat yourself as an obesity patient forever.
Right. So if I have high blood pressure, I'm going to take a statin pretty much forever. Or
I mean, like it really depends on what chronic condition you have. But I think that for any of these, right, for diabetes, once you have diabetes, those pancreatic cells have died, and this is something that you have forever.
Yeah.
And whether or not your A1C is in range or not, like you can't really cure diabetes in the same way. And I think obesity is the same thing.
Interesting.
So,
Interesting. Yeah. I don't know a lot about type 2 diabetes. Thankfully, we never got to that point. But I know that people with type 2 diabetes lose weight very differently than people without it. So with people with type 2 diabetes, can they come to Mochi as well?
Yeah.
And the doctor can help them as well? All right, great.
Yeah. I think obesity is its own chronic condition. And I think that's also where this theory of maintenance dosing comes from, right? Is that you're maintaining this, you're maintaining the weight, and you're maintaining, obesity is a condition that you have, and this is a treatment for obesity. And whether or not you're currently in BMI for obesity is not really relevant at that point.
Yeah, I'm on a 7.5 or 8.8 milligram. That's my maintenance dose, and I plan to be on it until forever, or till something newer, better comes out.
Yeah.
Or, so but I do agree. I think I'll probably be on this forever. So.
Yeah.
But it's worked like nothing I've ever tried. So I definitely want to have access to it long term. So
that's good.
Awesome. Well, thank you so much, Dr. Myra, for having us today in your offices. It's been great meeting you, and your employees are so enthusiastic. And this is a great office. They buy their employees lunch every day and breakfast too, I think. I want to come work here.
Yeah.
Can I move to San Francisco? No, just kidding. But yeah, it's been great meeting you and talking with you about Mochi Health. We are big Mochi fans, and we really appreciate it. So, and I know our viewers out there are Mochi people, so it's nice to put a face with the name, or that didn't make any sense.
Put a space with the name.
Put a space, right. It's a cool office space in San Francisco, so it's great. Well, thanks out there. Be sure you like and subscribe to The Downsized. Remember, I'm not a doctor. Dr. Myra's a doctor, but she's not your doctor. So before you start any healthcare journey, please check with your doctor or healthcare professional. Also, after you like and subscribe, you might want to check out our Downsized cruise. Christopher and I love to go on cruises. If you've been a subscriber for very long, you've seen us doing posts from cruise ships, and people have asked, hey, we'd like to go on a cruise with you. So we made the Downsized cruise, and it is now sponsored by Mochi. So thank you for sponsoring us to Mochi Health. You can go to our website, thedownsized.org. Click on cruise and check out all the information. It's June 23rd through 27th on the Celebrity Reflection. We're going to go to Nassau and Bimini in the Bahamas. It leaves from Fort Lauderdale, and we're going to have a great time. We'll have some Mochi swag, some meets and greets with Christopher and myself. Hopefully have some Mochi people that might get to come along. We hope you can join us for that. And again, go to thedownsized.org to check out all the details. And that's it. Don't forget to like and subscribe to our channel. And thanks for watching. I'm Laraine and Dr. Myra from Mochi from The Downsized. Thank you.